How do you monitor your LDL, HDL cholesterol on the keto diet? Are you curious about how to keep on your cholesterol levels while enjoying the ketogenic diet? Monitoring your low-density lipoprotein and high-density lipoprotein cholesterol is essential, especially since this diet can affect those levels. Let's break down how you can effectively track your cholesterol on keto. First, it's important to understand what LDL and HDL are. LDL is often referred to as bad cholesterol because high levels can lead to plaque buildup in your arteries. On the other hand, HDL is known as good cholesterol since it helps remove LDL from your bloodstream. The ratio of LDL to HDL plays a significant role in assessing your cardiovascular health. Before you start your keto journey, it's wise to get a baseline cholesterol test. This should include a full lipid panel that measures LDL, HDL, total cholesterol, and triglycerides. Knowing your starting point will help you see how the ketogenic diet impacts your cholesterol over time. Once you begin the diet, schedule regular follow-up blood tests. Aim for a lipid panel every 3 to 6 months at first. This frequency allows you to monitor any changes and catch any concerning increases in LDL cholesterol early. Keep in mind that individual responses to the ketogenic diet can vary. Some people, known as hyperresponders, might see their LDL cholesterol levels double or even triple. Others may experience an increase in HDL and a decrease in triglycerides, which is generally a positive outcome. If you want more detailed information, consider advanced lipid testing. These tests can measure the size and number of LDL particles. Larger, less dense LDL particles are typically less harmful than smaller, denser ones. In addition to cholesterol levels, it's also a good idea to monitor other health markers. Keeping track of your blood pressure, blood sugar levels, and inflammatory markers can provide a fuller picture of your heart health. Working with healthcare providers who understand the ketogenic diet can be beneficial. They can help interpret your cholesterol changes and advise you on whether you need to adjust your diet or consider medications. If you notice a significant rise in LDL, think about modifying your fat sources. Focus on unsaturated fats like olive oil, avocados, and nuts, rather than saturated fats. Also, ensure you are getting enough fiber in your diet and consider intermittent carbohydrate cycling if it's recommended. Finally, it's essential to understand the context of any cholesterol changes you experience on keto. While the diet may raise LDL levels, it often also increases HDL and lowers triglycerides, which can be a good sign. Some studies indicate that individuals with high LDL but also high HDL and low triglycerides may have a lower risk of heart disease. Monitoring your LDL and HDL cholesterol on the ketogenic diet involves regular blood testing, understanding how your body responds, and collaborating with healthcare professionals. Adjustments to your diet may be necessary based on your results, but remember that the overall lipid profile on keto can reflect a complex balance that goes beyond just the LDL numbers.